Hi, it's Dr. Sandra Cremers, and I'm here at Visionary Eye Doctors, and I wanted to show you the office. We have check-in over here, so this is what you can expect when you come in. We have a kiosk over there, which is trying to make things faster. Some people hate it, some people love it. If you hate it, there's these wonderful ladies here that can check you in. But I want to show you why it takes such a long time to visit one of the surgeons here. So the issue is that the eyeball, I'm going to kind of show you a show and tell here, so be patient with me, is like an old-fashioned camera, and there are many layers, and it's obviously a very important organ, and we want to image as many layers as possible. When I was at Harvard, we had different floors with different machines. So the glaucoma section would have the glaucoma machines, and the cornea section would have the cornea machines, and the retina section would have the retina machines. So in order to get a really good eye exam, sometimes even at Harvard, it could take a few weeks. When I first arrived to Visionary Eye Doctors, I was shocked because they had all the machines, the best machines in the world, in one room. We've been accused that it can be like an assembly line, and it's true, but you want that because you want every image, every layer of the eye to be imaged properly. So I want to go through the eyeball, and we're going to go through every single machine. So let me quickly just show you the waiting room, which is over here. Ironically, we have a wonderful video, a TV with all the information, so you should listen to it as much as you can, because it'll save you time so you can ask me the questions that you want to ask. This was here before I knew how damaging the screens are to the eyes, so I tell people just, close your eyes and listen to me, or listen to the information, and use your eyes for eye-worthy things, even in a doctor's office, even in an eye surgeon's office. So let's go in here. So this is usually pitch black because we need it to be dark, but we're going to go through the key machines so you can understand how we do this. So we usually will start off over here. Let me just show you here. So this is called an autorefractor. This is going to be used to tell us whether you have a imaging problem onto the retina. So it tells us what kind of pair of glasses you need, how much astigmatism you have, just a rough idea. So then we will get an idea of what kind of prescription you'll need for glasses. And then we basically will move you to this machine, which is called the Optos. And I don't have a picture just yet of it. Actually, I can show you one. But the Optos is a wonderful machine. It basically, through an undilated pupil, it's imaging the back of the retina. And let me just quickly show you what that can kind of look like. Give me just a moment. I think it's in here. So we're able, with the Optos, to determine if you have some terrible pathology without us having to dilate you fully, although that is wonderful. But you can get a really nice image of the optic nerve, I don't know if you can see this, the macula and the peripheral retina. So that helps us even pick up retinal detachments and retinal tears in patients that don't have any symptoms, which has been amazing. So it saves the surgeon and the patient a lot of time. And what we're doing with the Optos is imaging this part. We're going to go here to this machine, which is basically called the Heidelberg machine. It's an OCT and an HRT. OCT has a long word, but it's basically we're imaging possibly two things as needed. So the first thing we can image with this machine is the macula. The macula is what you see me with. It's what you see the world with. It has all your cones in it. It's what you see color with. And so that's a very important part of your life and your vision, because it's important for the central vision and your central acuity. When the vision is down, or somebody has a cataract and we can't see through the cataract very well, this machine will tell us if cataract surgery is going to improve the vision or not. It's going to tell us why the vision's down. It's going to just check out your macula. This machine also can check the optic nerve. The optic nerve is like the cable that connects your TV to your outlet, and it basically is in charge of producing the electrical impulses that get you the vision. So this machine can tell us if the optic nerve is abnormal, if the nerve fiber layer is decreasing, if you have glaucoma, if you're worsening in glaucoma. So this is a very important machine. This machine is called the pentacam. The pentacam is checking the cornea. It will determine if the cornea is shaped like a basketball, or shaped like a football, or like a cone, like this patient has this eye example is a cone. So we're looking for keratoconus. We're looking for something called Fuchs dystrophy, which means abnormality on the inside of this window. This window is called the cornea. The inside has these very important cells called the epithelial cells, and those cells are crucial in maintaining clarity of this window and good vision. So it gives us a prognosis also of how your vision could change over time based on how the cornea looks. This machine over here is also looking at the endothelial cells. It's called an endothelial cell counter, and it looks at that even more precisely. So these two machines here are for the cornea, and they're very important. This is one of my favorite machines. This is called the meibography machine. This is looking not even at the eyeball, it's actually looking at the eyelids. So the eyelids have those glands that you've seen in my previous videos that are crucial to produce oil. The tear film is like a pair of glasses. If you don't blink for 5 minutes, which I don't recommend to anybody, It can be very painful. It can decrease your vision because the tear film is like a good pair of glasses. So this is checking those glands, which are priceless, to make sure that you don't have any loss of those glands. And the last one I'll show you in this room, but there's a couple more. This one is called the IOL Master. This is a very wonderful machine. It's looking to see what kind of implant you would need if you have cataract surgery. And I think I have an example of what an implant looks like. We've talked about this in previous videos. The lens, which is located here like the lens of an old-fashioned camera, should be clear. When somebody develops a cataract, it can kind of look like this, very brown or white or even black, like I've mentioned before. And we want to put in the right implant. And the implant decision is very precise, and this machine tries to help us get it right. A very small mistake, such as a 0.01 millimeter mistake, could make a big difference in the power of the implant. So we do everything possible to check, recheck, and we just make sure that we get the right implant. So this machine is crucial to do that. So those are all the machines in this room. And believe it or not, there's 4 other machines that are not even in this room. One called a visual field, that we look at actually the field of vision. You kind of push a button whenever you see a peripheral light. It's looking at your field of vision and your central vision, so that's important, and looking at the optic nerve in the brain. And then there's an ERG and VEP machine that also looks at the optic nerve, because that's obviously very important. So that's it. So I hope this helps. If you have any questions, let me know. Thank you.